What's up, guys? It's Dr. Dan over here. We got Sarah in the house today. Sarah is going to get a full spine adjustment, but she also recently sprained her right ankle over in the gym. She stepped off of a bench and rolled it.
Yeah, like I stepped on the outside and just kind of
collapsed.
Yeah.
Now you also, what was the previous injury down here?
Well, I sprained it last September and doing a similar move actually in another workout class and
rolled it again.
Yeah.
Was that the first major injury?
I believe so.
Yeah.
Like I may have sprained it as a kid, but like I can't remember at this point. Like.
Yeah. So she had a pretty bad injury last year, which caused you to what, limp around and hobble around and.
For probably about 6 weeks or so. Yeah.
And then she just re-aggravated it. So we actually have been working with Sarah for about, I don't know, 3 months now, adjusting her. How have you felt so far?
Pretty good. Like any sort of back pain that I experience is pretty much next to none.
And previously was
like every once in a while, because like considering like my other job, since I'm out on my feet so much, like by the end of the day I would feel it, but now like I don't really feel it anymore.
So definitely pain improvement.
Yes, yeah. For sure.
Body awareness.
Mm-hmm.
Yeah. So we've done a lot of postural education with her, just shoulder work and hip work, and now we're starting to re-educate her gait, her stance, and her walk with some of the go-to coaching protocols. After treatment today, we're going to show you guys how to use the Neuroball. This is one of the products that we recommend for plantar fascia health, Achilles tendonitis health, just general foot health. What it is, it's a really awesome textured, stimulated ball that has these little, kind of like pyramids, these little nubs on them, which really help to stimulate the small nerves of the foot. And this ball, if we can get it open here, sometimes you gotta pry it pretty good. There we go. But this ball actually has a smaller treatment ball in it if you need to, or you can set the ball down on the floor to really get some movement into the bottom of the foot. So I'm going to show you guys how to use this post-treatment today. We are going to do a little ankle work on Sarah's ATFL, which is the most commonly sprained ligament. We're going to do some foot adjustments, some toe adjustments, some low back adjustments, and show you how we just kind of treat the full body. But we'll do this at the end. The Neuroball, you can find these on our website. They're really awesome. Neuroball is a company that is increasing. I think it's grown 3 times over in the past year. They have a great line of foot care products, textured insoles, standing mats for people that work at their desks at home, and really good for barefoot sensory stimulation. So we'll show you guys how to use that after. Cool. So a little bit of hypervolt to the shoulders, just to loosen up and improve circulation and to chill out or loosen up some of the neck and shoulder muscles up around the scapula. Any headaches, neck pain?
Not typically. I don't have headaches very often, actually.
Good.
Yeah.
Exercising a little bit throughout the week. I know with the ankle injury, we've calmed down for the past couple days.
Yeah, I'd like to get in today.
Awesome. What was that, last Wednesday or Thursday?
It was Tuesday of last week.
Tuesday when she sprained her ankle. So I had to run over in the gym. She slipped off a bench and rolled her ankle, and in about 2 days it was pretty swollen up and bruised up. So we did Graston it once or twice already. She's been lasering it daily, so a lot of the swelling is down significantly. The discoloration is pretty much gone. I didn't look too intensely at it, but it looks pretty decent today. She's also been working a lot on foot stances, some toe stretching, very gradual toe stretching. I think you've utilized the Hypervibe a couple times as well. She's been laying with her legs and calves up on the Hypervibe to help reduce any of that lymphatic swelling and ankle swelling. The whole body vibration, much like the vibration gun that we're using here, helps to stimulate and activate and drain the lymphatic system as well as improve circulation.
I've also been hanging out in the rocker.
Hanging out in the rocker position.
Yeah.
How's that been feeling?
Actually, I did it the other night for about almost 15 minutes, and it felt really good because it stretched everything out. Like I could feel it through the top of the foot very nicely.
And you know what you have to do?
Mm-hmm.
You just kind of have to like grit your teeth a little bit and just like push through it, you know?
Yeah.
Because definitely it's like good pain though, right?
It is. Because like it hurts, but like it feels good at the same time.
Yeah. And that's where we really try to get patients to like know the difference between bad pain and then good pain. And good pain is a good thing. It's like, oh, it doesn't really feel that great, but it kind of feels that great because it's doing something good for us. The rocker position that Coach Gill and the Go-To guys are giving to the world is one of the best knee, hip, low back rehab exercises that you can just nail daily. All right, let's go face down on the table. So right off the get-go, guys, when I just hold Sarah's feet down here, we can still feel the heat from this right ankle. There is still heat coming off of it just from the ligament sprain, strain, the connective tissue damage. You said you heard a pretty loud pop too, right? Mm-hmm. Yeah. So she heard a big, whether it was a cavitation, an adjustment, an ankle adjustment, a foot bone adjustment. But she did say, I heard a loud pop. So we do sometimes have to be concerned for fibular fractures or metatarsal fractures, which we would be concerned if, she stood up and could not weight bear or really was limping pretty bad. And I think after the initial shock factor wore off, she was able to get back up and say, oh, it's not that bad, right? Mm-hmm. Now we are feeling a lot of swelling down around the lateral side of the Achilles. You guys can see a little bit of bruising. Come around here, Bree. A little bit of bruising and discoloration on this lateral side of the foot, and also kind of just extending up into the top of the ankle and the dorsal portion of the foot here, right? Now this is much worse 2-3 days ago. We had some kinesio tape on it for a while. She's also been lasering it almost every day or every couple days using our light force deep tissue laser. You see how there's a little pocket of fluid right here as well. So we are going to do some gentle instrument-assisted soft tissue mobilization to help push the fluid back up the leg. We'll gradually do some toe adjustments and some toe stretches today. And then we're going to recommend that she starts really standing on the Neuroball to help the plantar fascia and some of the bottom foot musculature develop, just improve circulation and reduce any of the tight fibrous nodules that she's going to start to feel will develop post-ankle sprain just from fluid retention down here. Best things to do though, here in the office, we have the whole body vibration machines, which jiggle and loosen up her legs. I think she's been doing it every day now. Yay, or every other day?
Every couple days. Every
couple days. And it's really awesome to help improve the lymphatic drainage, the lymphatic fluid flow up from the body. Okay? I'm going to start up in her right hip. You guys might see some muscles jump through here because she is a little crooked in her right SI joint, which has been her little problematic area there since we started working together a couple months ago. She's just, I think, started nailing the rocker at home, the 4-point and 6-point rocker, which is really going to help long term. Sarah will develop wonderful kinesthetic awareness, really wonderful body balance awareness, and she'll be able to feel how the rocker will help improve the health of her right hip, her right SI joint, her right leg, her right knee, and her right ankle. Now we're going to travel gently down the leg, down the IT band. And then we're just going to start to get a little stimulation down here into the lateral leg and the outside foot. You okay? Mm-hmm. This vibration therapy really helps to stimulate the tissues and the cells. The arteries, the capillaries, and the veins to push fluid out of the interstitial space and get it back into the venous system to pump back up to the gut, back up to the liver, and ultimately all these broken down red blood cells and chondroblasts and fibroblasts and all the little cells that have rebuilt some of the tissue down here post-injury to flush far out of the body. All right, good work. All right, adjustments. Let's go arms down on the ground for me today. Right there. Take a nice, easy, deep breath in. Exhale out. Good. Deep breath in. Exhale out. Breath in. Exhale out. Good. Breath in. Exhale out. Good job, kiddo. Perfect. Let's do a little rib right here. Mm-hmm. Good. All right, face over to the window, right side up. Yep, perfect. Arms crossed, head up. Yep. Deep inhale, deep exhale, gentle roll, right here. Good job. Other side for me. Adjusting, awesome. Feeling awesome. So ankles coming, breath in, breath out, away out. Good, good, flatten your back for me. All right, so thoracic and lumbar pelvis adjustments, all wonderful. Now Sarah will feel on this right side, because of the ankle injury, there's already a little, feel that in there? Mm-hmm. A little bit of meniscus inflammation, a little bit of meniscus irritation. In some of the other videos, you guys have seen how we've done some double foot presses. I think we talked about this with you. Very simple rehab exercise. Press your feet softly together. And I just want you to lay in bed at night, and I want you to just work on this double foot press right here. It's really good to help strengthen the calves, the inner leg muscles, some of the hip muscles, and it's a good balancing position for the feet and the lower extremity. Okay? Mm-hmm. All right, cool. Let's relax right there. Before we do her foot treatment, let's get her neck adjusted. And then we'll end. Shoulder down on the right, like, good. Okay, good work. All right. All right, guys. Now, we're gonna finish up just with a general soft tissue treatment. You guys can see post-ankle sprain how there's bruising right around the toes, a little bit of discoloration. You can see how it kind of stops like right up around here. You can see how the faint little line from her skin, and then just the discoloration of the foot. So here's what happens, guys. So many people sprain their ankles and they don't flush out a lot of the damaged cellular waste material. And you guys can actually see how the discoloration from the white skin right here to a little bit, a couple shades darker right here occurs. And many people will have chronic, kind of like skin staining almost. If you don't flush this tissue out, you'll develop a little bit darker pigmentation of the skin that can stay there forever from an old injury. Your skin can change color. Your skin's kind of like translucent. You okay? Mm-hmm. All right. So what we're doing here, guys, is just a soft tissue treatment to help flush out some of the damaged cellular material, the oxidative stress, the oxidative waste that's developed post-injury. Feel a little bump right there? Is that pretty tender right in there? Yeah. So we feel, as we do this, we feel fibrous adhesions. Is that tender right there a little bit? Yeah, so we can feel her tender spots. And if she were to do nothing post-ankle sprain, nothing that we have been working on whatsoever, which is probably what you did the last injury.
Yeah, all I did was like ice it and elevate it last time.
Yeah, ice it and elevated are from the 1970s and 80s. And you're going to end up long-term, if you just ice it and elevate it, with long-term ligament injury, tendon injury, foot imbalance, which is ultimately going to mess up your knee, your hip, and really the whole way up into your head, neck, and shoulders, okay? So what we're doing here, guys, is a little soft tissue treatment that helps to iron out all the soft tissue structures and really elongates the damaged fibrous tissue to bring back healthy circulation into the ankle. We pair this with at-home exercises and whole body vibration and deep tissue laser to speed up the ankle recovery, and now you're actually fixing the problem for good. As long as she does some of the go-to footwork and she gets her ankles and her feet strong, her incidence of a future ankle sprain is going to be next to nothing. She's going to feel more strong, more stable, and more grounded on her feet. She'll be more sure of every step that she takes, as opposed to people that sprain their ankle and they don't rehab it and they continually re-injure it and re-sprain it and re-strain it again. So Sarah's been rehabbing her walk, and we have a couple intro videos of her that we'll put together, and you guys will see how her gait changes over the next couple months as she continues to walk better. Okay, lay back for me. Whew. All right, that's it today. Easy little baby foot adjustment. That's good. Easy little stretch. Good. You guys heard we got a couple toes to cavitate or release. Adjustments really help to reduce pressure, the tension, the swelling. You know, when your foot's so swollen you can't move anything. She's felt that. So she also knows at home she's working on some double foot squeezes, right? Squeeze the toes down, point the feet strongly down, squeeze your left foot and point your left foot for 10 seconds. Squeeze your right foot, point your right foot for 10 seconds. Feel how we get just a little gradual stretch on the top of the foot. Twist the toes in gently. Twist the knees open gently. And that's what puts us in that double bow set. You guys can see how she can dive a little deeper with this left toe versus the right foot. See how that's a little lower here? So she's going to work on really focusing on twisting and pointing this right foot down and in, so we can maximize the plantar fascia strength and eliminate any of the front chain strain, dominance, and overactivation, as well as injury and pain on this outside foot. Cool? All right, sit up for me. Finish our treatment today with a little Neuroball education. Now I'm going to show you guys a couple ways to do this. One is unweighted, okay? So if you scooch to the edge of the table, you can put this right under your foot. And again, guys, the Neuroball is awesome because it's got all this texture on it. It's going to really help stimulate the small nerves down into the foot. You know, slow movements, utilizing the Neuroball. You can gradually pick the toes up, slide the foot back. Let's pick this up, move it out a little further like this. Does that feel okay? Mm-hmm. So we're doing this unweighted right now, just with a little pressure through the foot. Unweighted meaning she's not utilizing her body weight to stand on the Neuroball yet. Bring it back. Press through the toes. Through the toes, good. Oops, 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 right there. Feel that shake right there? Mm-hmm. All right, now, just with a little bit of foot pressure, you can see how we're getting a little quiver out of the foot. Raise your heel up a little bit. Good, right there. Push down through the foot. Oop, oop, oop. So we're balancing on this ball. We're really helping to activate the intrinsic foot muscles. That's awesome. The calf is getting a nice little workout. This is helping to build some foot stability, some ankle stability, and some strength back in this weakened ankle that rolled under and caused us all this pain. Drop your heel down. Slide forward gently. Push down right through here. Now try to think. See how that shakes a little bit there as well. So this is just rehab that you do at home with the Neuroball. Now let's think twist the knee open so the ankle bone stays high. That, like, there you go, right there. Good, push down right there. Good. Whew. Okay, now drop your heel down low. Push down through that ball. Good. Come out here. And back. All right, pick your foot up. Let's see what this looks like on the bottom. Yes, nice. Come over here. So you guys can see how we got all the little imprints in the bottom of the foot. This is helping, again, to push fluid out of the interstitial space and really get in between each of the bones and the muscles of the foot and get all that fluid out so she can correctly heal and strengthen her foot. Cool? All right, let's stand up now. Double. where, whoops, we're gonna keep that guy there. Oh, he doesn't want to stay there actually. Let's step both feet. I want both feet like cupping the balls, right? The neuro balls right here. Okay, good. Yo, easy, easy, easy. That's good, right? That's good right there. Okay. So when we double, if we wanted to double up, some foot strengthening exercises, this is a wonderful position to work on. Creating the arches in the feet, gently twist the knees open, and just kind of grip right down there. You okay with that? Mm-hmm. All right, cool. Twist your hips left, twist your hips right. Feel how the hips feel, and maybe one direction is a little easier than the other direction. Mm-hmm. You can feel how the ankle stretches, the tibialis anterior muscles are working really well here. This is one exercise that we can do with the double Neuroball. It's great to develop intrinsic foot strength and plantar fascia strength. Let's step off, and then let's face the wall, left foot forward, and then we're gonna put the right foot back, like that. And then guys, we can use this Neuroball, and we can just have her, you know, assisted against the wall with a little bit of strength here. We can have her just work on heel pressure, knee rolling out gently, and just kind of like gently mobilizing the foot over top of the Neuroball. Ultimately, spending a little time here developing that position right there, pressing down into the ball. You'll start to feel how this leg shakes like kind of crazy right here. Twist this open right here. Good. Perfect. Oh, there it is right there. Mm-hmm. You guys can see how we're getting a little bit of back chain activation, a little bit of core activation. These are all go-to coaching protocols for back chain dominance. Raise the foot up, and then we can passively pick this whole foot up off the ground. And then we can passively just have her just work little foot pressure down through there. Knee open a little bit. Good. Let's think heel up a little bit. Oh, right there. Push through there. And you can see how, we're getting that back chain mega powerful. See how easy that is? Mm-hmm. Drop this heel down. Press down through the front of the foot. How's that feel for the foot? Does that stretch pretty good?
Yeah.
Does that feel pretty good on there? Press down. Twist the right knee open. You guys can see as we really activate the back chain, we're keeping the medial malleolus high. We're keeping the Achilles safe and strong. And you guys can see how she's getting the central nervous system activation with a little shake. Drop the heel down lower. Push down right here. Perfect. Okay, cool. So those are some of the rehab protocols with the Neuroball that we want to implement for Sarah. We're going to have her finish up with some deep tissue laser here at the office and then get her on the Hypervibe later today. But we got to roll to the next appointment. I hope you guys had fun. Stay tuned for future videos. Thank you for watching.